over Zambia, AIDS is a reality. In this country, which has never gone through any civil war, the world's most deadly and undeclared war sweeps mercilessly through the land. The victims don't cry out, families recoil in shame, leaders avoid responsibility. This silence heralds victory for the disease. Denial cannot keep the virus at bay. The latest tragedy is that so many people don't know what is going on or just pretend not to know. Kaloko Trust is an NGO which works to improve the lives of the people in the Luansobe Valley, Copperbelt province of Zambia. Every day, the organization is forced to come to terms with the reality of HIV in the area. The main constraint in this area is that vital information on the deadly pandemic cannot reach the Luansobe Valley communities because infrastructures and means of communications are not present at all.
The roads are impassable. We have got no many television, if anything. Radios are very rare in this area. And the problem of newspapers, which cannot reach us here. And this makes it at least a bit difficult to get information as regarding to the disease.
The Kaloko Anti-AIDS Cultural Club was established in April 2002 to placate the spread of the pandemic in the area, despite the lack of infrastructures and means of communication. Through the use of traditional music, dance, and popular theatre, the program aims at promoting awareness, prevention, and care for those infected and affected by HIV/AIDS.
We operate by involving members of the community, especially children and the youths. With them, we look for the roots of the problem of HIV. And we use traditional dance and drama to address it.
So as warriors, we are strong, we are energetic. Nothing can threaten us. But now there is this HIV virus and no one can resist it. You see the virus coming in. Immediately you see it, I expect you to go out, running in fear.
The problems of HIV/AIDS in the Luansobe area is not only huge and diverse, but also complex. Sex with multiple partners and extraconjugal sex is extremely common.
You are a man who want to prove the masculinity and the strength. And to do this, you get involved in sexual intercourses with different women. Proving how strong he is by bending in front of each woman, and each woman will be dancing on his back. Now, the HIV virus, you are following him. And by following him, you are infecting each single woman. But you're silent, because we want to express that you can't see the HIV virus, but he is there.
Widespread poverty and high rates of unemployment in the communities are associated with high-risk sexual behavior. Women especially lack financial independence and access to resources.
ekobata baba balebomba balebadisha kofyo twakulya kashichi twatota sana pamlandu wa Kaloko.
Many young women become sexually active as young as 13 years old. Teenage girls often become infected at a younger age than boys because they are biologically, socially, and economically more vulnerable both to infection and to unprotected or coercive sex with older men.
Why they are scared to say no to sex with other elders, teachers, is because they fail to say no. They feel scared of chasing them.
Condom use is very low.
In an effort to promote condom use, we as a health center actually are providing free condoms to the communities. Many people stay in very far areas. We said 16 kilometers from here is quite far, and so people to come all the way from there to just come and collect condoms, it's really difficult for them. So we need actually more help to reach out to these people.
People believe, when you use a condom, you don't enjoy the sex to the fullest.
99,000 people die of HIV-related diseases every year, all over the country. Every year, another 30,000 people become infected with the fatal disease, 1 in 4 adults. As shocking as these numbers are, the impact of HIV/AIDS does not end with them. A less well-known effect of the AIDS pandemic is the vast numbers of widows left to care for their children alone, and of children orphaned by this illness. There are 520,000 AIDS orphans in Zambia. Many have been forced on the streets, and 87,000 children are living with the virus right now because of mother-infant transmission.
My dad passed away. When he went to hospital, he was told that he was HIV positive. And after a year, my mom also became sick. And after she became sick, she was also diagnosed of HIV. I wasn't able to go to school because at that time, what was the priority for me, or the first priority for me, was to look for food. The local trust is really helping me with education.
When my parents died, I was 8 years old. I just going in the street to beg some money. Someone give us food. We start fighting because food doesn't satisfy. By this time at the street I'm not there, but there is my sponsor at Kaloko Trust.
In Luansobe, very few people speak about HIV, the sex that spreads it, and the condom that can prevent it, because such topics are considered taboo. In such a climate, also discrimination thrives. Ignorance breeds unfounded fears that the virus can spread through casual contact and heightens rejection of those suspected of having the disease. HIV-positive patients are left to die alone.
I think the problem is that there have been very little information on HIV/AIDS and how it is transmitted. So most people have just assumptions to say maybe if I touch him or maybe if I eat with him, then I'll get it.
Dance and drama have a powerful effect. They do not only call people for the meetings, but they allow them a chance to understand the message, whether illiterate or literate. They also accord children a chance of educative entertainment.
The best way of understanding a situation is through being able to visualize the situation. And this is exactly what forms of communication, artistical communication, such as dance, drama and music are able to do.
Malangizo onse na mwambo. Malangizo onse na mwambo. Koto mwonse pita mwambo. Kila malangizo. Aika. Asa mbani zake. So mpitirize vana masiku vana ali amatu. Aone lako.
Yes.
Sakondwe mpitirize.
Okay, good.
Ndabila vimpulupulu.
The program also tries to promote knowledge and appreciation for the cultural heritage of Zambia as a key to self-esteem, social cohesion and cultural development. The struggle against the HIV/AIDS plague is very hard work and the needs are high, especially in financial terms. In view of this, the Kaloko Anti-AIDS Cultural Club also acts as a fundraising tool towards the sustainable implementation of the program.
Behavior change is a process that takes a continuous and a sustained effort, and large financial resources are required to carry out this program.
Against the background of poverty aggravated by global trends, debt and inappropriate budget priorities, AIDS programs are starved of resources. The developed world is largely silent. Total spending on AIDS in Africa is no more than an annual budget of a small hospital in Western Europe. AIDS in Africa has never commanded the full-bore response the West has brought to other travails. It is therefore essential that projects tackling HIV/AIDS are given high priority in development strategies and allocation of funds.